Good afternoon and welcome to Washington Policy on the Go. Thank you so much for your patience. We had a late start today due to unavoidable circumstances, primarily dealing with my own flu-infected household. So that's where the origin of the delay comes from. No fault to our fine center directors who are also in limbo waiting today. We have with us Elizabeth Hovde, who is our Center for Healthcare Director, and Finne, our Center for Education Director. They will both be joining us to talk about the latest that they've seen in legislative action in Olympia. I also want to remind everyone that we have some big business in Olympia. Tomorrow is Washington Policy Center's Olympia Day. We'll be down in Olympia in full force, center directors visiting with some key legislators, as well as our senior management will be down there, and then we'll have a legislative reception in Olympia. And then the following day is the oral arguments for the income tax case before the state Supreme Court. Jason Mercier will be there in person. He'll be covering that with analysis. I'm sure you'll see it on his social media Twitter feed, hopefully on the blog first. As I'm always telling Jason, go to the blog first, then Twitter. But you will definitely see coverage from Jason on that event as well. And make no mistake, despite the constant repetition from advocates, it is an income tax case, and we'll decide if Washington stays income tax free or not. And so we'll be following that very carefully. And we have been trying to inform the public as broadly as possible about the nature of that tax, and hopefully you're seeing some of that yourself. So be on the lookout for that. I think first we'll start with Liv. Liv Finne is our Center for Education Director, and don't forget we changed this format a while back, but just in case you're joining us now from the legislative session, we used to do Q&A at the end with all the center directors who are here at one time. This time, and from here on forward, what we do is we just take your questions as they come. So if you think of them, put it in the Q&A box, and we try and get all your questions for the center director as they're speaking, so that I can incorporate them into the conversation. It makes it easier to slice the material up for people who, for example, if your focus is on education and you don't have time for anything else, you could watch that and get all the Q&A information that you need. And that's the purpose of doing it that way. So Liv has some new material out, and one of the things that she's watching is how critical race theory is working its way into Washington State, and how aggressive some are in terms of its advocacy. Liv, why don't you describe for us what's happening in Washington State and what the legislative action is involving CRT?
Yes, well, I have testified already on several bills that are attempts to seize control, attempts by the state to seize control away from local school districts over the selection of their curriculum materials. Under current law, local school districts have the responsibility and duty to pick the specific texts that are used in their school districts. And now I'm seeing complaint procedures being created to the state. If somebody in Seattle doesn't like what Kennewick is doing, they can bring a complaint to the OSPI, and under threat of loss of funding. One of the bills would take 20% away from the school district of Kennewick if Seattle people didn't like the values that are being taught there. So that's one bill I testified on. There's another bill that is doing the same, trying to reduce local control and take it to the state, because the state resents the fact that some of these districts have their own values that do not agree with violating the civil rights of students, violating the equal protection of the laws. And so they're coming to try to use force to intimidate school districts into following the OSPI set of values on diversity, equity, and inclusion, which is critical race theory. I saw another bill that hasn't been heard yet. It's Senate Bill 5441, which again is threatening state control over the selection of curriculum materials at the local level. That hasn't had a hearing yet, but again, you recall in 2021, the governor and the state legislature passed Senate Bill 5044 to require CRT racism, state mandated racism in the training of teachers, of every employee in the public schools, including school board directors. And now they're moving forward to, several districts have opposed this movement and passed resolutions to treat every child as fairly, regardless of the color of their skin, to respect religious views of teachers in the schools, to honor the consciences, to protect teachers against speech codes, to protect teachers against having to lie to parents, to protect teachers against having to, violate their consciences by teaching that the children are bad because of the color of their skin. So these, this was done in 2021, and now the state is trying to mandate its enforcement across the state school boards. We have a system of local control, and this is what you're seeing, a fight played out over centralized power versus local power. And it's amazing to see our civil rights under direct threat like this, and that this fight is being played out on the backs of children in Washington state.
You remember, though, the local control rhetoric was very big in the not so distant past. Among, it's always been big among some, especially among, I think, right-leaning people. But there was a lot of talk about local control during the whole McCleary debate about the need for local control. School boards should decide these things, and local control comes up an awful lot. So it's kind of jarring to suddenly find, well, I should say it's jarring, and I'm being a bit facetious because I expect it in some ways, because there are people with ideologies that, they're like the Borg, resistance is futile.
Yeah.
Can't stand the idea of people doing things a different way. There's always some need to be, the hero in their mind. Everything is the battle between good and evil. And if things aren't going their way, then, they're standing against the incarnation of evil to stop them from spreading it to future generations or something. But in this case, they want to control what is taught to kids, throughout the whole state, which is, that's not going to sit well on the east side. The problem is the east side of the state is 25% of the population. So, it's going to be a difficult a battle if the west side legislators go along with this.
Yes, well, I am actually quite hopeful about this, because our system of power puts control in locally elected school board directors. Okay, 295 districts in Washington state have 5 to 7 school board directors who are elected by their local communities, and there is a movement afoot to hire to make amongst voters. Particularly activated voters now that are upset about the civil rights of their children being harmed, moms, groups and other activist groups are forming in Washington state to elect school board directors that share their own values, that don't have Seattle values. And this is scaring even the people in Seattle, because they don't like to see sort of our democratic form of governance over schools is actually enabled and exerted by people's votes. So I see it's quite exciting, because all of a sudden there are people studying in Washington state who are upset about their children being hurt by racism in the schools and other things, and they're getting organized. And so they can try to push back on local control, but the statutes are very strong. We have a system of local control in the public schools. That the laws, there's 2 separate RCWs that describe the responsibility of school board directors to select curriculum materials, specific textbooks. Okay, so it really comes down. The state can describe general standards of learning like it does, but and requirements in state law for what children are supposed to be taught. But when it comes down to selecting the specific textbook carrying out that requirement, is very clearly written out as the responsibility of locally elected school board directors. So this movement to seize control over this a very important function of school board directors is I'd say an anti-democratic move.
Yeah, I mean, certainly if you want to respect the will of the people locally, and education's such an intimate thing. That's why I've always favored school choice. Is it's like,
Mhm.
there might be a parent out there who's pretty radical. In fact, I'm related to many to many people who are very lean very far to the left, and I don't want to control how they raise their kids, right? I mean, I
Right,
just, I don't view that,
right.
as, I mean, I'll say facetiously, I wish I could. I'd have my conversation, but I don't feel it's my job to decide for them what values they inculcate in their
Yes,
children,
you have a,
outside of the most extreme,
right,
but
right, right.
but then you have another group just trying to redefine what acceptable is, and that
Right.
becomes smaller and smaller. It's almost a French Revolutionary approach to politics or policy, where, if somebody who disagrees with you, they become the enemy,
I know.
the parameters keep getting smaller and smaller. It's
Well,
bizarre.
it's amazing to watch it because the attitude is very hostile. Okay, now I'm seeing. I mean, these are schools. These are public schools. We should be raising people up, not tearing them down. And I'm seeing dark language now, assuming from the left, from these bills that are being introduced in the state legislature, that assumes that everyone in the schools is racist. That assumes bad behavior, which is not true. It's just it's just false.
Yeah.
And so I see us going down this dark path. But on the other hand, this last week, literally, you spoke about school choice, Dave. It's super exciting what's happening in other states. There have been 7 bills in 7 states, and I think I can remember them all, introducing universal school choice for all the citizens in that state. And here are the states: Iowa, Indiana, Texas, Utah, Oklahoma, and I think Arkansas. So that's 6 states. And some of them don't have school choice programs at all. So we're seeing a steady expansion to now we have, in existing law, we have 32 states offering families access to a portion of their education dollars so they can hire tutors or pay private school tuition. There's 32 states: Puerto Rico, Washington, District of Columbia, and Washington, D.C. All those places, it's not controversial to give money. Oh, I know. The 7th state is Florida. Florida is expanding its school choice program to a universal program. In the past, these programs have been targeted to, particularly deserving populations of students, like special needs students or children who are in failing schools or military children. Now we're talking about bills that are offering access to these dollars to every child in that particular state, following on the exciting bill passed in Arizona last summer. So that is telling you something, that the parents are getting motivated. They're not happy about what happened during COVID, closing the schools. They're not happy with diversity, equity, and inclusion, state-sponsored racism. They're not happy, and they're looking for options.
Yeah, and I think, gosh, I mean, you and I would remember the days when there was party lines, when there was one phone company, and now people the newer generations, are growing up with so many more choices and seeing the power of choice, seeing the power of the marketplace, that, just because you open up a system to competition doesn't mean, that everybody's ruined. Some businesses will certainly fail, others will get stronger than ever, right? I mean, Walmart's been competing with Amazon, and both are surviving and battling it out, and new kinds of competitors and boutique competitors have come up, and the number of cell phone providers, there are people who are paying $150 a month, and others are paying $15 a month for service, because they have different needs and different desires, different price points, and it's improving service across the board. So there's lots of excitement there about choice that I think has never been applied to this kind of policy before. But I think there's more people just taking a step back to say, wait a second, what's the great danger of me deciding, where my child goes, and why should it just be this way? I think there's
Exactly.
culturally, there's been kind of a shift. I mean, there's still a strong
Yes.
kind of, we all there's a certain social glue that happens with a uniform system, but
Yeah.
it's not like you live in high school forever, right? I mean,
Well,
there's a
yes,
way to get
exactly.
beyond it.
Well, exactly. I think this cultural shift is very important, and I think part of that is the question that you raise: why can't I do what I want to educate my child? That's really important. But also taking responsibility. That's part of that thinking, that question in your mind. Instead of being sort of passive recipients of what the state decides to provide, families are saying, "Hey, it is not so hard to homeschool children. I can do as good a job at or better than the state can in educating my children." And that idea that give us the support so we can do this ourselves, I think that's super exciting. And you hear about all these innovative models. There are those pandemic learning pods that existed, where families got together and they taught their own children when the schools were closed. Those are now morphing into homeschool co-ops, and they've got all kinds of names for them. But it's basically families getting together and saying, we're going to do this ourselves. And of course, that's fueling this move to get some of their own state taxes returned to them so they can pay for curriculum materials or even hire a teacher. I mean, why not? Why not?
Yeah, you got a few questions for you coming in. One is from Idri, wants to know, how would you define racism as you're speaking about?
Well, racism is very simple. When the teachers are taught to treat one child one way because they are a certain race, that's racism. All right. Teachers are not supposed to teach a white child that they're oppressors, that they are responsible for the sins of their white ancestors 200 years ago. That is a wrong thing to do. And it's also wrong to teach brown and black children that they are not going to succeed in school because they live in a racist society, because it's just not true. It's false. It's harmful. It's racist. I wrote a study called Know Your Rights. It's on our website. And it lays out the many laws that we have passed at the state and federal level that say that every child deserves equal treatment under the law. Every teacher deserves equal treatment under the law and can't be discriminated against on the basis of race. And in that study, I thought I'd read this little clause, Dave, that was so great. And we included even the United Nations Universal Declaration of Human Rights, okay, which says this: even they recognize the civil rights of man. It says this, and I quote, "All human beings are born free and equal in dignity and rights. They are endowed with reason and conscience and should act towards one another in a spirit of brotherhood," unquote. And this is what the schools are getting away from. They are looking at children, dividing them on the basis of race. This is racist and it's illegal, unconstitutional. I expect it to be struck down by the courts or in the court of public opinion.
Well, I want you to know I put the link to your study in the chat. So if people want to see Know Your Rights, you can visit the link I just placed in the chat there. Next question: what is the effect of national directives on local school boards?
There are some. There's the State Department, the Federal Department of Education has passed laws requiring states to test every child in grades 3 through 8, and once again in high school. And that's the most impactful law that has been passed. But there's other laws like federal Title IX funding, where that's affecting this debate also, because the definitions of sex are being changed by the feds. And this is affecting the radical gender theory teaching in the schools. So they do have an effect.
Next question: can the state or OSPI circumvent the RCW regarding the textbooks by injecting curricula that is not textbook based?
Can they? Could you repeat that? I didn't quite get it. Yeah.
Can the state or OSPI circumvent the RCW regarding the textbooks by injecting curricula that is not textbook based?
They cannot. That law, though, I can give the person who wrote the question, that RCWs that state that the textbooks are selected by the Instructional Materials Committee created by the school board directors in local districts. So OSPI may try to do that, but it's illegal.
Next question from Nelson. Do you think that possibly, I guess there's a typo there, I am as a tan horse, with school choice, I'm afraid it's really about letting the government get deeply entrenched in private schools, especially religious ones, to expand and dictate their miseducation system. He who pays the piper calls the tune.
That is a very good question, and I'm often asked that question. And believe me, that is something that we have to watch out for, without a doubt. However, other school choice proponents in other states have heard that concern. And in the most recent school choice bill passed in Arizona, there's a whole section that addresses that provides that non-public schools accepting dollars from the state will not be considered public for the purposes of curriculum selection, for the purposes of religious instruction. It's expressly called out as not allowed by the Arizona Universal School Choice Bill. So that's a very good concern, but if we write our laws carefully, we can protect private schools and independence from the state.
If the federal government if the federal Department of Education mandates testing, can the Department of Education mandate the content of the test?
No, the states, the power lies in the states to select the tests that are given to the students. But in practice, you'll remember the whole fight over the Common Core. There were different consortia of states that got together and created tests that were consistent with the Common Core. All right, so this is a problem, no doubt about it, that the tests themselves are requiring, allegiance to these ideologies. And so, it's ironic here, of course, Dave, because we've got laws saying that there should be no bias reflected in these tests. But I'm now hearing that there are questions on these tests that reflect bias, the racist bias of the diversity, equity, and inclusion. So we have to be vigilant. One thing I'd say is that in rereading this Know Your Rights paper that we wrote, there's a provision in the US Code, which I think is also very important for people to know. And here I'll read it. Protection of pupil rights. No student shall be required to reveal information concerning, in part, political affiliation or beliefs, sex behavior or attitudes, mental or psychological problems, antisocial, self-discriminating or demeaning behaviors, critical appraisals of parents or other close family relationships, religious practices, affiliations, or beliefs. I have to tell you that the Healthy Youth Survey that is being given out to students across Washington state violate the US Code on pupil rights. They're asking intrusive questions about sexual behaviors, about relationship with parents. And I think that should be avoided. And you don't have to, your students who are in public education do not have to fill out these surveys from the state because they then use the results from the surveys to declare that, oh, 20% of the students are sad on X day. We need to have mental health counselors for everyone. You see what they do?
Yeah. I guess last question for this, because we got to get to Elizabeth Hovde for an update on her work. Jim writes, potentially, how would school accreditation work under a school voucher system?
Well, the accreditation is done by independent groups that are licensed by the state to do that. So that's something you have to watch, because some of these accreditation groups have gone off, the rational, middle of the road approach. So look, I agree. There are governance policies that the state controls, like accreditation of private schooling, but our civil rights should not be subject to those accreditation laws. Okay, I mean, it's a question of asserting your rights to equal treatment under the law. And when people get together and insist that they're not going to teach, state-sponsored racism, like in the districts of Kennewick and Richland and Peninsula and Chehalis, when people stand back and say, look, you're not going to do this to our children, this is in violation of their civil rights, then people somehow find that they can agree. So there's a lot of fear around this, of course, because there's a lot of name calling. But I think if you believe in equality of treatment under the law, then you should stand up for that and not just cower when someone calls you a name, you know?
I watched I don't know how new it was or old it was, but I watched an interesting speech recently with Jordan Peterson talking about the problem with professional boards and others being taken over basically by people whose ideology refuses to allow them to see the benefit of allowing, you know, people even in medical professions or legal professions to, you know, to get outside of their political ideology. And
Right.
so he was warning against that kind of approach and called it the Eastern European approach, which I thought was effective because, you know, really, you know, you don't think of it that way until somebody brings it up. It's like this is a dangerous approach because you want people to challenge who you are, and you want and you want people to be free to pursue their, you know, what they want to be. And the more you control that and put these other priorities ahead of, you know, for example, medical knowledge or things like that, that's a real dangerous game to play. So, you know, all these things, it's like freedom requires vigilance. And so there is no safety, there's no security, there's just, you know, pushing forward and continuing.
But this is happening. This is exactly to the point of, you said, you're exactly right. Jordan Peterson foresaw this happening to the professional organizations like the American Pediatric Association, the American Medical Association. They're all fighting. The leadership of some of these organizations has been taken over by this ideology that is racist. And now the grassroots within that are saying, hey, no, we got to stick to our mission here. We're doctors. We have to believe in the facts. We can't just accept your ideology as what we're here for. So I'm seeing this playing out across the country and everywhere. Leaders of universities, leaders of medical associations, legal associations. This is the fight that's happening right now in Washington, in the United States. And I'm encouraged because I'm seeing more and more people standing up for the civil rights.
Well, Conrad Lee says local controls being threatened in land use, housing decisions as well. Says the Bellevue Council voted 5-2 not to oppose bills that threaten local control.
Oh, really?
Yeah, which is sad. And then I wanted to let you leave with this compliment from Vince Navarre. He says, I have the Know Your Rights paper as a main resource reference to argue. It's an awesome work. Thank you. I'm an anti-discrimination disciple, he says.
Thank you, Vince. I appreciate that. Thank you, everybody.
Yeah, thanks, Lee. Appreciate it.
Okay, bye-bye.
Now let's turn to Elizabeth Hovde. She is our Center for Healthcare Director, among other titles. And because I feel like you've been tasked with the sad but necessary task of following every nook and cranny of the Long-Term Care Act. Let's start with that. What, if any, updates are there on the Long-Term Care Act, and is there any movement in Olympia on that particular issue?
Yeah, well, there's two bills. One is has just been introduced, and it is a delay bill. It would basically delay the long-term care payroll tax collection that's supposed to start in July, a year, to next July 2024. The bill that I especially like is House Bill 1011, and it would repeal the long-term care law now that lawmakers and society is able to see how problematic this bill is, how inadequate it is, and how it harms low-income workers. So I'm hoping that will get a hearing, but it hasn't yet, and I have been told to doubt that it will. The Speaker of the House is actually the person who brought the original long-term care legislation forward and got it passed. So my hunch is that the Senate bill, which is just a delay bill again, has probably a better shot at getting a hearing and getting considered. But those are the two ones that are out there right now, and hopefully we'll see some discussion this session.
Well, you mentioned earlier that I think it was the last time we had you on the show, but you mentioned earlier that, payroll taxes are going to go up. I think that was the paid family leave issue. And then there's this possibility again of delay of this, but what it's showing is kind of a spread of the payroll tax chipping away at income. And I've said this before, but just like life is lived in the moments, your money's lost in little bits at a time. I've learned that the hard way over the years. And you see it actually at the grocery store right now. You go in for a few things and you're wondering, wait, what happened? So have you seen any, and I know you haven't read about this or anything, but have you seen or heard of any new kind of payroll tax approaches happening or expansions of the current ones?
There's just no is the short answer, but the longer answer is there are commissions going all the time, one regarding universal health care, for example, and they would draw on a payroll tax, I believe, to help fund that hope. There's always talks about it, and that I fear that, right, that payroll taxes are the new vehicle for getting social issues passed and creating government programs for people in need and people not in need. And so I have calls out to lawmakers to hopefully meet with me about that soon, give us some heads up about any payroll taxes on the way that we can try to stop, like we're trying to stop this one. The long-term care law is bringing a payroll tax that will harm more workers than it will help, in my opinion. And even the people who qualify for this someday and who happen to need help with long-term care, a lot of those people would be on Medicaid assistance for long-term care anyway. So you're taking money from them now to help them pay for a need they might need later. And so it's not even a true safety net where you're helping the poor, you're hurting them to help them. It's different than so many other programs that are suggested.
Well, you wrote another blog, and this, we've talked to people who are involved with hospitals, on the boards of hospitals, and there's a severe financial crisis hitting hospitals right now. It doesn't get a lot of media play because, let's face it, you don't necessarily, it's not going to impact your care right away. But it does have long-term implications and can reduce the amount of hospital care available because ultimately somebody's got to pay a bill. So why don't you talk about the blog you wrote about the state needing to reimburse hospitals for the care provided patients in its programs?
Yeah, there's a Senate Bill 5103, and it's actually a bipartisan effort, and it's encouraging. It's asking the state to fully pay the true cost of the patients it has on Medicaid and other programs. So it would be sending a bigger reimbursement rate to hospitals to keep difficult to discharge patients in their care. Right now, they're doing that. They're not being reimbursed in the right way with the proper amount. And so what's happening is you see hospitals having the cost borne by people who pay for health insurance. Senator Ron Mazzal is the sponsor of this, and he has Democratic co-sponsors with him. But he said he had the luxury of going over hospital finances and long-term care facility prices over the last 3 years. And he found they were able to determine that in many cases, private insurance was picking up the bill for the shortcomings in Medicaid, Medicare, and some other government programs. He said that one hospital, I remember he said that it's charging 170 to 180% of the actual cost to private insurance to make up for the shortfall. And the senator was just right on in talking about how this is not sustainable, that we continue to put more and more people on government health care, and we expect people paying for healthcare to pick up the cost. Lawmakers need to better understand that the issue of medical cost increasing for all of us is exacerbated by them continuing to offer a helping hand to those in need and those not in need. And that their decisions to have more people on Medicaid, which they've made in several different ways, is bleeding out on all of us, these costs.
You did, there was a blog you wrote also that dealt with the abortion bills in the state, not specifically about abortion, but about the issue that, once again, there's, there's all kinds of politics involved in that particular debate, but it's a new mandate coming down on companies and how that adds to the cost. Describe that, whether there's, what you meant in how that impacts costs and where else we might be seeing, new mandates on insurance. Because one of the things we've been complaining about is the more times you tell an insurance company you must do this and you must cover that, and there can't be any copays for this, can't be a copay for that. Ultimately, again, those costs add up, right?
Yeah, people across the state have all sorts of views on abortion, and they also have all sorts of views on whether taxpayers should be paying for abortions or not. And this is another way to spread the cost of abortion. And it really doesn't have anything to do with that. It has to do with increased cost to consumers of insurance by putting regulations on insurance. So SB 5242 seeks to ease the burden of out-of-pocket cost on abortion seeking patients by eliminating cost sharing for patients seeking abortion care. And when I listened to the hearing on this, there was a lot of statements that the cost of abortions, even with insurance, is a barrier to care. And really that argument can be made for anything, right? I mean, you have cancer, you have cost related and copays and deductibles and all that sort of thing. Medical costs are real and they hurt all of us. And to put another regulation on insurers to ease any area of the services they're providing in a way that doesn't make sense for them or the people who obtain their insurance is just misguided. And
yeah, that's I mean, that you hit the nail on the head there. That's what I was thinking too. I mean, I've known people with terminal cases of cancer, going through horrific battles, and I'm very empathetic to my mom was a mom at 15, and that was a very difficult thing for her. And but when you think about healthcare, for a lot of different issues, I've known people with the cancer battle, like I said, people who've one person I know had a child that was didn't get her oxygen. There was a complication at birth, and so there was all kinds of horrible complications there that are going to impact them the rest of their lives. Another little girl who had got some kind of a cold virus or something, and it just changed. It paralyzed her basically. I mean, she was in and out of hospitals. As far as I know, she still is. So there's all kinds of issues, but the copays and other payment issues, they affect them. So crafting all these rules based on the politics of the moment is, it's I'm not sure it's a slippery slope, but it's an expensive one ultimately for, and those costs get passed on to other people, like the people we were talking about, right? I mean, everybody else who's struggling with whatever complications they have in their own life.
right.
So,
The rising cost of healthcare is a huge issue, and it's talked about in the legislature a lot, and yet no one's connecting no one.
few.
We're not
Yeah.
we're connecting the dots that we are creating so many regulations. We are a contributor to the cost of healthcare, and this all goes back to, for me, both in the Center for Worker Rights and Center of Healthcare, which I oversee those. It goes back to the safety net issue, right? We are we are people who create safety nets for people in need of help. We don't create safety nets, or we should not, for people who are in need and people who are not in need. And we need to stop doing this. And this is another regulation that not only deals with creating a safety net that's too wide, but also ignores all the other out-of-pocket healthcare costs that people have. It's flying under the banner of abortion. And so it might get the reason I am tuned into this issue is because of what a high priority issue it is, and how today was abortion day in Olympia, and they were talking about all these different policies that will help in their effort to make healthcare for abortion more accessible in the state. But again, increased regulations on insurance, whatever those are going to increase the price of care. And the more people you have not paying for healthcare and being government dependent, whether they need to be or not, impacts all of us and all of our premiums.
Yeah, well, as you say, there's there's some people are in financial need and others aren't. And when you create safety nets that are overly broad, you're making things more expensive for people who might have a different issue. Maybe it's equally serious and equally traumatic and even more dangerous, and yet they're not going to, they're getting more expense because of the burdens inflicted on their insurance. So
both paid family medical leave and long-term care, the long-term care program, both of which take money via payroll tax for people. It's the government saying, I'm going to create a savings account for you that you have to pay into for these 2 life needs, 2 or 3. We all have life needs. They're all different, and people need more of their money that they earn to deal with those life needs. And, the state totally has a role in creating awareness. I think a lot of people are more aware that it's possible they will have long-term care needs in the future, and they better start thinking about it, but these two, just allocating these 2 areas for a savings account, which you may need someday, you might not, but you might have other life needs. It's not financially wise.
Thanks, Elizabeth. Appreciate your time as always, and I'm sure we'll be seeing you again now that this is weekly and the legislative session's in full swing. You've always got a lot on your plate, one way or the other. So appreciate it, your time. And don't forget, folks, check out the Washington Policy Center blog on a regular basis, because like I say, we are in the midst of the legislative session. This coming up day after tomorrow is the oral arguments for the state Supreme Court on the income tax case. So watch for that. Obviously Washington Policy Center will cover it. We'll provide analysis of what happened at the oral arguments. It'll be interesting to see how the rest of the media covers it, because we're consistently told by advocates that it is not an income tax. But if you've read the work of Jason Mercier, the words of the IRS stating, what is capital gains tax? It is an income tax. All 49 other states say it is an income tax. Even other countries treat capital gains income as capital gains taxes as income taxes. And Mercier has put all this together. The rules that indicate how people are supposed to pay this tax in Washington State refer, I want to say Jason said 32 times to your income taxes. So it's really a way of asking the court to impose by fiat what they've been unable to get past the voters. 6 times voters have said no to a constitutional amendment. The court ruled in 1932, and again, I think another time in the 30s, and another time in the 50s, and once in the 60s, saying, look, if you want an income tax, you have to have a constitutional amendment. So there's every reason for this to be a fairly simple case to be tossed for the Supreme Court to simply restate what past precedent has been, but one never knows what the court is going to do. So it's a big issue for Washington State. I remember a few years back in when I was working in with the legislature in the Senate communications staff, I remember watching a big debate when Senator Phil Fortunato had a constitutional amendment proposed to ban an income tax, and there was all kinds of speeches made about nobody's proposing an income tax, nobody think about an income tax, this is a giant waste of time. And yet here we are, here we are talking about the possibility of income taxes in Washington state. Unless you think they will stop there, you should note Jason's one of his latest blogs details how there's already a bill before the legislature to expand the newly created income tax on capital gains, which they're not calling it an income tax, but a rose by any other name is just as sweet. So with that, watch for all that's happening this week with Washington Policy Center, and thanks so much for joining us.